Senator Colbeck will have the floor, and then when he is done, we've got another mic here. If he wants to do a little Q&A, we can do that. And thank you very much, Senator Colbeck, for joining us today. So, Deborah?
Hi everyone, I'm M1 here. My name is Deborah, and I just wanted to introduce Senator Colbeck. I met his wonderful wife Angie a couple months ago actually at a function, and I talked with her quite extensively about, so she's a pediatrician, so she's very involved in, being a doctor and the healthcare field with my husband as a senator. And so I talked with her about the importance of us as medical students in understanding how the legislature and healthcare policy really does affect the way we practice medicine. And so I'm very grateful for Senator Colbeck to come and speak with us and allow us the opportunity to talk with a person really directly involved in legislature and healthcare policy in the state of Michigan. So please welcome Senator Colbeck.
Thank you very much. It's really an honor to come out and be able to talk to everybody here. I know you guys are all, I remember my wife when she was going through residency, and I didn't see too much of her, so I know how precious your time is, and I appreciate that you're willing to come out and listen to some state senator from Wayne County to come out and talk to you about healthcare reform. The presentation I'm going to be talking about today is the same presentation that I gave back in Dallas a couple weeks ago to a suite of legislators from all over the country. About 38 different states were represented there. Attendees at the conference included Governor Bobby Jindal and Senator Ted Cruz. And the presentation that was talked about here was pretty well received. A little bit of background on me. I'm a freshman legislator, so I'm just finishing up my first term in elected office. I'm actually an aerospace engineer. Went to the University of Michigan. Bachelor's and master's degree out there. Worked on the space station for quite a few years. I was not one of those kids that dreamt about going into politics. As a matter of fact, I tried to stay as far away from it as possible. So the idea that I got into politics was not an easy decision for my wife and I. Ultimately, for us, it was a faith-based journey. And since we've been there, it's been a big challenge. One of the catalyst moments for me on why I wanted to get into politics and why I wanted to get active in it was what we're going to be talking about today. It dealt with the Affordable Care Act. And I've got some concerns. We'll go through it, but I'm going to walk through why I have those concerns as we go through here. And then hopefully give you a little bit of light at the end of the tunnel, because there's some things that are happening right now across the country that are very promising for not only the medical profession, but also for the patients that receive the care from the medical profession. So there's some good stuff that's happening, and I want to be able to highlight some of that good stuff. A little bit of other background for me. Even though I'm an aerospace engineer by background, the last 11 years I've been doing management consulting in a variety of different industries, but I've been a consultant for major healthcare or health insurance provider right here in the state of Michigan, southeast Michigan. I've also provided consulting services for major hospital system here in southeast Michigan, as well as a major pharmaceutical company. So over the last decade, I've actually seen the changing landscape in medicine and healthcare field across the board. And it's also one of the reasons why I'm so concerned about the direction we're headed in with the Affordable Care Act. But instead of going into too many details,